The thing is, elevated blood pressure isn't just a number on a monitor. It's a direct measure of the mechanical stress that your cardiovascular system is under every single day. When pressure is chronically elevated, your heart has to work harder to pump blood around your body, which over time can lead to left ventricular hypertrophy or thickening of the heart muscle, which reduces the heart's efficiency and increases the risk of heart failure. Your blood vessels have to withstand higher pressures continuously, which damages the endothelium. It promotes atherosclerosis and increases the risk of a heart attack and a stroke. Your kidneys are exposed to higher pressures, which accelerates kidney damage and increases the risk of chronic kidney disease. All of that is well established. What's less well appreciated is that the mechanism driving elevated blood pressure, which is chronic insulin elevation, sympathetic overactivity, and endothelial dysfunction, are the same mechanisms driving a whole cascade of other metabolic diseases. Type 2 diabetes, fatty liver disease, polycystic ovary syndrome, Alzheimer's disease. A meta-analysis published in Diabetes Care examining data from over 100,000 participants confirmed that insulin resistance is independently associated with increased risk of cardiovascular disease, even in patients without diabetes. These are not separate conditions that happen to occur together by coincidence. They are different manifestations of the same underlying metabolic dysfunction, and that dysfunction is fundamentally about hormone dysregulation, particularly around insulin. When you address the root cause, when you fix the insulin problem by creating proper fasting windows and allowing your hormonal system to reset, you're not just lowering your blood pressure, you're reducing your risk of essentially every major chronic disease that shortens lifespan and degrades quality of life as you age. That's the real prize here. Blood pressure is the thing we can measure easily. It's the thing that gets people's attention, but the benefits extend far beyond the cardiovascular system. You're improving metabolic flexibility, you're reducing systemic inflammation, you're enhancing cellular repair mechanisms, you're improving sleep quality, you're optimizing hormone production. All of those things feed back into better health across every system in your body. So let me bring this full circle. Blood pressure doesn't stay elevated because you're eating the wrong ingredients necessarily. It doesn't stay high because you're lazy or because you lack willpower or because you've failed at some moral level to care for yourself. It often stays high when the hormonal system that controls pressure never gets a chance to reset. And for many health-conscious people, the reason those systems never reset is not because they're doing the wrong things, it's because they're doing the right things at possibly the wrong frequency.